All right, Basic Education Minister Angie Motshekga has announced that the COVID-19 vaccination of educators and support staff will start this Wednesday in a bid to ensure that teaching can continue despite the pandemic. So the vaccination program will last 2 weeks until the 8th of July. Motshekga was addressing the media in Pretoria earlier today.
We will be vaccinating all teachers in the PESA, which is where we register our educators, administrative and support staff, irrespective of age. We'll also be vaccinating, this I thought I should raise because it kept on being raised in the morning. We'll be vaccinating even teachers who are school governing body appointed teachers and those employed by independent schools. That's why we also had a meeting with them to make sure that we have a comprehensive program of all the educators in the sector. In total, for the next 10 to 14 days, we plan to have almost 582,000 people in the sector vaccinated. And there are stringent guidelines which we have been given by health that if you are on a PESA, your details have already been captured on the electronic vaccination data system. Also, we have received the list of SGB appointed educators and from independent schools, but also using the information that we have from SABC. We want to emphasize that we will not, or the system, not even us, will not allow an on-site registration, meaning that persons not bulk uploaded on this vaccination information system, they cannot be registered on site. Therefore, which means they won't be vaccinated. And this should, if it should happen that you are not vaccinated, you have to go and register and come back having been registered on the system.
Well, the minister also says there's no need for a national closure of schools because of the increase of COVID-19 infections. This follows calls from different sectors that schools should not reopen in July as the country is experiencing high infection rates as the country is in the midst of the third wave of infections.
We've been having engagements because initially our meetings with MECs this morning, it was meant to update them on the work and the progress around vaccination. But because of these high infections that we have observed in the past few days, we couldn't avoid talking about our response as a sector to say, what do we do in the face of these high infections that have been taking place? As I say, we monitor weekly to see what is happening. We get statistics almost every day, which schools were disrupted, which schools, how many learners were affected, for us to take an informed decision. And this morning, when we reflected on that, all provinces, including national, agreed that yes, indeed, any infection is one too many, but the levels of the current situation we find ourselves in does not warrant that we should close schools. I gave an example that this week, in the information that we collected, 100 schools were reported to have been disrupted, with the majority of them being in Gauteng. And we're saying we have 25,517 schools. 100 schools were affected. So 25,400 and something schools were stable. And we just felt on the basis of facts, there will not be any ground for us to go for a wholesale school closure, that we should continue to have what we are currently using, a differentiated approach. If there's any reports of any difficulties, the principals know what to do, the circuits know what to do, and we'll manage it that way. But we are also not ruling out the fact that if any time during the week, advised by your ministerial advisory committee from health, advised by the National Command Council, advised by cabinet, we will resist closing schools. But we felt that schools are closing in any case quite soon. We're going off quite soon, I think less than 2 weeks. We'll be breaking, and we will want to break orderly now that we have a very disrupted system. So when you go on break, teachers have to prepare work for kids to go home and really make an orderly closure of schools, and we prepare ourselves for the next term.
So there's been lots of reaction to this. Earlier, SABC News spoke to the South African Democratic Teachers Union, and this is how they responded to the vaccination of educators.
We want to say as a union that vaccination works, vaccination is safe. And therefore, as the organization and the leadership of my organization, we have taken a decision that we as the leaders will be leading in the front in terms of taking the vaccination, because we believe that it will assist us to have a defense line for our educators as the frontline workers and so forth. So yes, we'll continue to talk to those who are hesitant and those who have received fake news. We will continue to counter misinformation and disinformation. And some of these are said by people that are supposed to be respected in the communities and really talking against vaccination without really looking at the scientific facts around the vaccines and so forth.
From SATU, let's bring in now Basil Manuel, who is the president of the National Professional Teachers Organization of South Africa. A very good evening to you, Mr. Manuel. Thanks indeed for your time. So, first of all, your reaction to the minister's address on the vaccination of teachers.
Good evening, Griselda, and thank you for the invitation. Griselda, we are, of course, as NAPTOSA, we are elated by the news that after all the months of hard work, the months of lobbying, the months of working together with a whole lot of people, we've eventually gotten to this point. And of course, it's not only about NAPTOSA, the other teacher unions were involved, and the ministry gave it its full support. So it was sweetened by the fact that a week ago we heard 300,000 vaccines would be available. Today, that was 580,000, and that made it even more sweeter, because what we wanted is that every single teacher, irrespective of whether you're governing body paid or state paid, or you are in a private school, that you must be vaccinated. But we also wanted every education worker vaccinated, and that is the reality. And the sweeter news is even that our ECD centres are included. So that says that we are looking after everybody. So NAPTOSA is elated. Now we need to see that it works. We need to see that all the plans put together come to fruition.
Mr. Manuel, I guess the question would be, how well prepared are the provinces? I know that due to history, Limpopo and the Northern Cape have been provinces of concern previously. Do you have any concern about how all this will then roll out, particularly in the provinces? I guess the proof is in the pudding with what will happen in the provinces going forward.
Zelda, I want to be as positive as possible. I want to say that I hope that this rollout is going to set the benchmark for how vaccination should be done in the country. That is my hope and desire. I know that even when we had the J&J hiccup, provinces continued to prepare. We were given the assurance. We've seen the plans. And if the plans on paper are anything to go by, I don't believe we're going to have a big problem. But yes, there will be hiccups, but they mustn't derail the system. Northern Cape is a particular concern, given the sparse population and the vastness of the area, and getting vaccination sites as close as possible to where the people are. And that is a plan that is being worked on. I know that Limpopo has been given some additional assistance even now, and we are confident that that will all come together now, even over this weekend. But I want to say that I believe that given the force of the collective that is busy working towards this, that we can't but be successful. And I want to see this as something that will be held up to say, this is how it should be done.
An ambitious target being set of vaccinating 499,000 teachers within 10 days. You think that's realistic?
It doesn't sound so when you first say it, given how slow some of the other rollouts have been. But the logistics this time are a bit different. The education departments in the provinces have set so much in motion. Secondly, of course, one of the reasons or one of the positive things about the schools being kept open is that clusters of teachers are going to be going to the vaccination sites. Schools are going to be called. That's unlike individuals coming in when a date and time arrives. And that is certainly going to assist in seeing that we have large numbers being pushed through the system. And of course, the Department of Health that manages this has assured us through the DVE that they are ready and they have the manpower. And if all these things fall into place exactly as I'm saying, then I have no doubt that, ambitious as it may be, we are still going to be successful. Because remember, the president of our country has called on us to get to 300,000 a day.
Yeah.
And this is 580,000 in 2 weeks. Surely that's manageable.
We'll certainly all be monitoring that, I think, together with the unions in the sector. Thank you very much, Basil Manuel, who's the president of the National Professional Teachers Organisation.